Good afternoon. And today I have a pleasure of interviewing my longtime professional friend, Dr.Corina Atanase. She is my full colleague. She helps patients sleep and breathe better at night. And also she helps with the problem with temporomandibular joint disorder. Good afternoon, Corina.
Good afternoon, Maria. So nice to be here with you.
And she is a big supporter of my book, Breathless.
Absolutely.
So today, we're gonna dive into real challenges of treating sleep apnea in a dental practice. And we both have 15 years of experience, so cumulative 30 years of experience of managing patients with these conditions. We're going to talk about strategy with technology and learn how dentists help patients who struggle with the CPAP and help patients to uncover the root cause of sleep disorder breathing, which often start as a pain in a jaw joint. And
right.
get referred to us from ENT with exactly that complaint. And the root causes as mouth breathing, airway issues. We're going to discuss those and strategy to address that. But another topic what's so close to my heart is collaboration with the medical community. And now it's become more and more special collaboration with dental community. So this interview would be great for dentists, for sleep professionals of any field, physical therapists, myofunctional therapists, and patients who are looking for practical, real-world solution to sleep disorder breathing, to the process of being tired during the day, mental fog, constant nap, so not feeling themselves. So my first question to you, Corina, we met that many years ago on a dental sleep conference, and we're both from New Jersey. How you start with sleep? What encouraged you to do sleep?
Yeah. Well, it's true. I mean, a lot of us, I think, went into the dental profession either because we had a good experience as children, or we had challenges growing up. And so I had TMD problems, and I was treated by wonderful dentists. And it started my journey into going to dental school and learning how to help myself and at the same time help other patients. So that has always been at the forefront, is like, if I would do what I want for my patients, what I would want for myself, right? So I happened to go to a conference and learn. It was a TMD related course, and they introduced the idea of sleep apnea as being the underlying problem along with TMD. So that kind of opened up my eyes and started me on this journey. And the more and more I learn, I see that connection between sleep apnea and TMD. That's not to say that everybody who has sleep apnea has TMJ issues, but sometimes they are related because your body has to do something to open up that airway. So if you start off as a child and not being able to breathe through your nose well, and then your upper jaw doesn't develop as well, and then the lower jaw follows the upper jaw, and that lower jaw is smaller, and your tongue has nowhere else to go except back and close that airway, it just snowballs over the years, and then you can have all these other issues that pop up, right? So as I'm learning more and more, and I know you are too, Maria, we want to intervene as early as we can. So I try to tell my young parents, make sure that you're feeding your new child harder foods that can be chewed, even if they don't have teeth, broccoli that's steamed, and, have them use that, those muscles. breastfeeding, so important for multiple reasons, but I know sometimes it can't be possible. So just like that myofunctional learning how to use our tongue and lips and all of that, so that everything develops well. Now, of course, we have a whole generation where we haven't been using the harder foods, and we had the baby foods. I myself fed my kids, the jar food. I didn't know any better at the time. So, learning, trying to help those patients that also are having the issues now by I'm always focusing on the nasal breathing. That's like mostly important. If we can breathe better through our nose, like even the little kids, when they come in, I just had a patient yesterday who happened to, the main complaint was bedwetting and grinding of the teeth at 7 years old. Well, I'm looking in, and they've got, big tonsils, not huge where they would have to be taken out. So I told the mom, let's focus on that nasal breathing and see if we can get those tonsils, because our bodies are amazing, right, Maria? They will, if you put them in the right position, they will try to heal. Your body can
Trying
heal,
to heal.
right?
Oh, I
So
agree with you. Like we have
I don't.
exactly the same thoughts.
So yeah, so I'm like, why take body parts out if we can let the body heal itself? So breathe through the nose, and then you can filter that air better and not have the tonsils have to get big because your mouth breathing and all the bacteria and the viruses are coming in. So and then it affects the airway, right? So if we can, that's my spiel on the nasal breathing.
Yeah, I want to ask you a specific question. For younger patients, do you use the tools like we're talking about non-custom appliances? What you find, what's your view on that if you do
Mhm.
that type of training? Because, of course, we know a lot of colleagues in our field, and it's right, we have to be very focused on specific things, but parents who got treated by us and they feel better with sleep apnea, of course they feel more trust in that particular area, and it's still not so easy to find airway focused dentist. It's possible to find, but then it's become a lot of other layers. Of course, with somebody who you already work with, it's so much easier. So tell me what you do for kids to
That
help them breathe better or to help them develop
well,
better.
the oral appliances like the MyoBrace, I'm gonna put the name out there. Um, it helps because it's got that myofunctional portion to it. Still, working with a myofunctional therapist, I think, is really, really important,
Really
because
important.
there's other exercises that a child can work on to improve their nasal breathing and swallowing and all of that. But the appliances are great because it reinforces the idea of closing the lips together, breathing through the nose, and tongue position and all of that. So it's really important. But of course, you're relying on the patient's cooperation, the parents' cooperation. It's not just the fixed. Like, let's say you want to expand the arch, right? When they're little, you put in those fixed appliances. I think it's great. Yes, we need that space, but we also need the tongue and the
To
lips and
follow.
everything to work. Otherwise, things are going to collapse.
No, this is a beautiful topic you mentioned. Yes, I highly support early expansion, but I also believe in the form and function together. And
Right.
that part I really touch in my book. That's a story, but that's one of the elements of the story, how you can at least that's my philosophy. The little people, the kids, they're
Yeah.
not, they are fully, they're smart. They understand. They might not have a desire to grasp it right away, but they're very smart and they see the parents' reaction. So if parents is invested in the treatment, the child usually will follow. And I'm not talking about from, I have two boys. I have examples at home and I observe it a lot in my patients. So I personally think what function is important component, and at least it has to be introduced first, just like you mentioned about nose breathing and tongue position with non-custom, and then to put custom-made expander, what's going to create that form, what's going to be supported by function, because it's true. I have a whole generation of people who had expansion as a kids, and they had straight teeth at a certain point, but that did not hold. And they end up as my sleep apnea patients. And even without 4 bicuspids, they crowd it again.
Oh, yeah. Yeah.
That's a very common story. So going back into this not small population of people who had orthodontics, which was available at the time when they were growing up, I know, just like me, you use clear aligners and oral appliance together to create the space for the tongue. In the same time while controlling the apnea. So can you tell us your strategy? Because obviously oral appliance is already uncomfortable. This one is clear aligners and oral appliance on top of it, and we cannot use silicone appliance. We have to use, normal appliance, acrylic appliance with expansion screw in the middle. So give me your view on this model of treatment, which I'm really big proponent.
Yeah. I love that too, because a lot of times, just like you said, the patients have a smaller upper jaw and lower jaw, and they're already crowded, right? So they come to us because they have the sleep disturbed breathing, and at the same time, they want to align their teeth again, either because they had ortho before and things collapsed, or they just never did ortho to begin with. So to align the teeth and make a beautiful smile and functional as well, to help with the sleep apnea, if we just do the clear aligners by themselves, we will get a nice result of, a very aesthetic result, but it doesn't address the sleep apnea portion of it while they're expanding, because they don't have the room, right? Then, so we have to bring the lower jaw a little bit forward and let that airway stay open during sleep. So during the day, they can wear their aligners just like all the other systems, but at night they need to wear something to help that sleep apnea, so that they can, not have the side effects that sleep apnea is all about. You don't want to continue having problems with the heart and
I agree with
else.
you. I agree with you. And yes, it's true. It's not as comfortable. And after that, I usually inspire my patient. I promised them, I said, I'm going to make it much smaller. If you still have apnea, we're going to check. Most likely, we need to do that. It's a lifelong journey. But yes, it's uncomfortable, but that's for longevity, for your sleep. It's very, very important. I'm going to ask you about TMJ treatment. What do you do for people who have that issue? How you approach problem in a jaw joint?
So taking the pressure off of the joint. So what happens is when a person has TMJ issues, it's usually because they're clenching so badly that disc that is in between the upper jaw and the lower jaw is the only one that moves. I know sometimes people get confused with that, but the disc gets banged on over and over and over, or stretched, right? Because it's got ligaments and muscles that are attached to it, and those get banged on, and that's where the pain occurs. So if we put the lower jaw a little bit down and forward in a position where it's comfortable, we let that heal on its own. And so even, doing the clear aligner therapy, a lot of times that's enough of a cushion to not have those symptoms occur over and over. So it's like a dual thing
effect.
that helps.
But I want to mention about your clear aligner therapy system. Your clear aligner therapy system has myofunctional therapy elements.
Yeah.
And I think that's also plays significant role in TMD, temporomandibular joint disorders relief. Not only moving the teeth from interference, what create that particular stress, but also, people retrain tongue, which is a great support for temporomandibular joint, and
and nasal breathing.
Nasal breathing.
Absolutely, yeah. So the system that I like to use a lot, the Nuvola system, it started, actually, it's made in Italy, and they have been very innovative in my mind, because they have the clear aligners, but also along with the clear aligners, you're using a myofunctional appliance during about, like, you're supposed to do at least 30 minutes a day. So it's like little exercises where the patient learns to position their tongue in the right spot. And by doing that, it helps to expand the upper arch, and everything moves much more freely. Another point I want to make about the clear aligners in general, not just Nuvola, I think it's a much gentler system to use, especially for adults, teenagers too, because the movement is a lot gentler than actual braces, in my opinion. And then all the studies that have been made too, there's less chances of resorption of the roots and things of that nature, because that pressure on the teeth and the system around the teeth, the ligaments and everything, is much gentler. So anyway, going back to the myofunctional, I think that this system works really nicely because you're training the tongue and the cheeks, and focusing on the nasal breathing, and it all kind of works together to give you a better result long term that's more stable.
I just want to, clarify for our patients. So when you put patients who have temporomandibular joint disorder in a clear aligners, they have another device which has, we can call it airway muscle tongue coach, what they have to use for 30 minutes to exercise tongue, cheek, to swallow with it, keep the lips together, and breathe through the nose.
Yeah.
And after they're done with clear aligners, you recommend them to continue doing that, or how does it work when they graduate from clear aligners?
Yeah, I mean, if they have no symptoms and they're doing great, then they still should use their clear aligner retainer to just maintain the teeth where they are, but it's not necessary to do those exercises anymore, because what happens is when they do those exercises, it becomes a natural thing. So you already instantaneously know where to put your tongue, and you swallow better, and you breathe through your nose instead of your mouth on a regular basis. So
Yeah,
Yeah,
no, that's, like
it just becomes instantaneous.
yeah, I'm a big believer in a recall system. Maybe I'm a micromanager, maybe that. I have a question about my book. So I'm very thankful what you are supporter of my book, Breathless. So of course I want to know why you decide to support it. Besides being
Because
a very nice person.
no, well, Maria, I just think you are wonderful to talk about these things that are important to our patients and to other dentists that are wanting to go into helping others in this field, and other providers too. It's all about collaboration, and this is another collaboration.
Yeah, that's true. That's true. So my last question is about collaboration. How it's a kind of a helpful tips for somebody who thinking about dental sleep medicine and TMD, but of course there are tons of obstacles we both know. So what's your not clear approaches, recommendation, advice? I just wrote the article 8 secrets of successful collaboration with the physician. So I found 8, and it's going to be published in the sleep practice in the summer. So I hope that article going to be helpful for all our colleagues or people who desire to do that. So what your secret of successful collaboration?
Yeah, I think I collaborate with ENT doctors and sleep medicine doctors, sleep doctors, and dentists too, because we're all in this together, right? We want to help our patients. Every time I get a patient referred to me, whether it's from an ENT doctor or a sleep doctor, I still have to know their dental history, because we're working with their teeth, whether it's the appliance or the TMD or anyway. So all of us have to be on the same page. We all have to know how to help our patients the best, and we have to create those connections. I think it's really important. Uh, in terms of how, I guess we meet in different places. It's good to always make figure out who the doctors in your area are that are receptive to your way of a way of treatment, to have similar philosophies, because then it makes it easier. The patients can relate better, and
Of course.
we can give them the best results.
So your way, you usually go through the patient. When you have a specific patient, you contact the provider team of
Right.
that patient. But
Yes.
how do you make dentists? Because I know a lot of dentists would definitely benefit from our help. It's true on TMD issue. It's true on another very specific issue called breaking restorations, because that
Hmm.
can lead to patient retention issues. Patient would
Yeah.
just get upset and leave. So what's your secret of collaborating with our colleagues, with the dentists? Because everybody, of course, we're all scared. We don't want to let our patient go to
Of
somebody
course.
else, what they might like, and they might leave. So what's your secret when you start this conversation?
So, I mean, the patient, they're comfortable with their dentist. That's wonderful. That I always encourage the patients, you have to keep up with your dental hygiene visits, because, you don't want to be trapping anything, right? You're wearing an appliance at night. You don't want to be, having other problems. So whenever I see a patient, I either send a letter after my consultation to the dentist, and let them know what I found in terms of what the patient needs for a medical portion, but that I encourage them to go for their recare and having all their dental work done. So I think, getting that note and understand that when they understand that you're not there to take their patient away, you're just there to be part of the team.
Thank you very much, Corina. I hope our audience learn a lot from you and just 30 years of experience, and you gave a lot of practical advice. I hope, your patients, I'm sure, are very happy with you and they feel refreshed, and I really appreciate you being a supporter for my book. And I hope it's going to help a lot of your patients to get a better sleep.
That's all we're wanting to do.